Yes. We had a rating scale, of course, 1 to 4, and the informants in our study was caregivers, either family or employees in residential settings, knowing the person very well, at least 6 months. But most of the informants had known these participants for a very long time. The pack was administered for the two groups, and the reliability of the psychopathology and autism checklist was already studied very closely in the validation study, and we used the validation study to establish cutoff for the 5 subscales. And then we analyzed all data for occurrence of the 4 major psychiatric disorders: psychosis, depression, anxiety, and OCD, and for differences between the two groups, and also for the occurrence of general adjustment problems. And we used, as you can see, very simple quantitative analysis. And here I wanted to present the results. These are the results for the occurrence of general adjustment problems. And this first slide shows the number of persons with adjustment problems in the autism and ID group and the ID group only. And as you can see, this is a percentage. So, as you can see, there are a lot more people in the autism and ID group that has a lot of general problems like unrest, sleep problems, self-mutilation, aggression. And that was expected. And the blue column shows the percentage of people who are having both general adjustment problems and the psychiatric disorders. And as you can see in the autism group, it is more than half of the participants. And in the ID-only group, it is about approximately 1 out of 5, 20%. And the purple column shows the percentage of participants having general adjustment problems only. And those are, in fact, not many, but there are some. And that is that is also a proof of it is some people, they have a lot of trouble, they can be aggressive, self-mutilations, all these problems without having psychiatric disorders. Because 20 years ago, all kind of these problems were associated with the disability itself, what we call the diagnostic overshadowing. But now, today, that we know a lot more about psychiatric disorders, it's easy to jump to the other conclusions, that all kind of aggressive behavior, other general problems, is a part of a psychiatric condition. And that is, in fact, that might not be the case. So in each individual, we have to be very careful before we say that aggression or other behavior is a psychiatric problem, before we assess it very thoroughly. This is the average amount of general adjustment problems within the subgroups of individuals having psychosis, depression, anxiety, and OCD, according to our results. As you can see, the patients having general adjustment problems only without comorbid psychiatric disorders have a low level, fairly low level of problems, while all the other subgroups have quite high amount of general problems. And this might generate the hypothesis that people with autism and intellectual disability, and also people with intellectual disability only, have a lot of trouble with their daily life when they have psychiatric disorders, which is not very surprising, actually. But what was a little bit surprising to us, that we had the hypothesis that people with autism, when they have psychiatric disorders, they will have more general problems than people with ID only, because we know that people with autism have a lot of daily trivials to struggle with. But what we found in this study is that once people with intellectual disability get the psychiatric disorder, having autism or not, they have a lot of trouble. As you can see here, the ID-only group is the purple column, and the other light blue is the autism, and there are no differences between these two groups. So what we found actually was that people with intellectual disability only have the same amount of daily trouble as people with autism when they have a psychiatric condition. And I think that's something to be aware of. Whoops. Now I want to present one other rather interesting result from our study, and that is the overlap problem. As Miss Stret? No. Your name is Stret? Speck, yes, sorry. Speck from Holland presented to us overlapping symptoms between schizophrenia and autism Asperger syndrome is quite common and very difficult to differentiate. But it's also very difficult to differentiate between the unique psychiatric disorders in people with autism, because they present their symptoms often in rather atypical ways because of their idiosyncratic way of both behaving and speaking. So that, as we can think, that they have the same symptoms, but they present them in ordinary ways. And this makes the overlap also between the psychiatric conditions in people with autism a large problem in the diagnostic process. As you can see, for example, the group that were identified with above cutoff values for psychosis, these are 16 people in the autism group. Of those, 13 scored above cutoff for depression, 12 for anxiety, and 6 for OCD. So this says that at least 6 people in the autism group scored above cutoff for psychosis, depression, anxiety, and OCD at the same time, and of course a lot of general adjustment problems as well. And then, what is a relevant diagnosis then? That's a rather large challenge for the clinicians that shall do the diagnostic assessment. And as we know that the treatment will be rather different from the different groups of psychiatric problems, the diagnostic process is very difficult.
5 more minutes.
5 more, yeah. I don't think I will need all these minutes, but okay. So to sum up, we found differences between the groups. But our main finding that a lot more people in the autism group had both general adjustment problems and psychiatric disorders compared. The two groups compared. It was not very surprisingly to us that more than half of the group with people with autism had a lot of daily trouble. This is what we see also in the clinic. But that the differences was so large was rather surprisingly. What was also rather surprising was that the huge amount of people with autism having psychiatric disorders. I want you to remind that this was a screening study. We did not conduct diagnostic assessments to all these 62 individuals, but we gave message back to the clinical units at the Norway Hospital on all individuals having high scores, so that they could do the further clinical assessment on each participant of the study. But we didn't get those results back. But there were more than approximately half of all the participants with autism. They had a potentially psychiatric disorder, not a condition, but a disorder. Psychosis was approximately present 3 times as often in people with intellectual disability, and that is a very interesting result. As in previous studies, psychosis has been found not to be more present in people with autism than in the general population. We don't think this is right. We think it's quite wrong. We think that people with autism become psychotic a lot more often than ordinary people, but the criteria in use are not good enough to catch these people. And that is quite a challenging situation, because psychosis is a serious disorder, and people with autism become they can live untreated for 10, 20, 30 years with psychosis without being understood, and they will have very poor lives. Yes, and of course other conditions were also a lot more present in people with autism. And as other studies have been pointed out previously, psychiatric disorders are highly prevalent in adolescents and adults with autism, and some authors have even said that psychiatric problems might be one of the main challenges for people with autism as they grow up. Yes, I think this is it.
Okay. Thank you.